Pediatric care is the branch of medicine that deals with the development and care of infants and children and the subsequent treatment of their diseases. Pediatric medicine is a very general title to a variety of different special illnesses and subjects. Some of the specific illnesses can be categorized in one of the following. This type of care would cover treatments with an abnormally high sensitivity to certain substances such as pollens, foods, or microorganisms. Common indications that may send a child to an allergist may include sneezing, itching, and skin rashes. Commonly also includes asthma and eczema. The branch of medicine that is concerned with the skin and any skin-related diseases. This could also cover the hair and nails as well. From diaper dermatitis to frostbite to acne, all are items that would be covered within this care. The study of the medical aspects of hormones. This includes such diseases and conditions of hormonal imbalance, the hormonal glands, and the possible use of synthetic or natural hormonal medicines. In pediatrics, this includes diabetes. Is the branch of medicine that deals with the diagnosis and treatment of the gastrointestinal tract. This would include disorders affecting the stomach, intestines, and the associated organs. Colic, chronic diarrhea, pediatric Crohn's disease, and even protein intolerance are all items that would be covered in this type of care. Is the diagnosis, treatment, and prevention of diseases relating to the blood and bone marrow. Discovering things like blood clotting and closely related blood disorders are extremely important, especially in children. Infectious diseases are caused by a microorganism or other agent such as bacteria, fungus, or virus. These microorganisms enter, grow, and multiply, and they may or may not be contagious. Croup, measles, mumps, chickenpox, and hepatitis A and B are all known terms that would fall within this type of care. The science that deals with the kidneys and their functions or diseases. Uric acid stones, the Potter syndrome, and pediatric nephritis are all different items that are within this type of care. Improper nutrition can cause many issues in children. It is vital that your family medicine doctor considers a child's potential food allergies and other nutrition factors. This care is not just for malnutrition, but also obesity in children. Oncology is the study, diagnosis, treatment, and prevention of cancers. Cancers are known to be found in many areas of the body. Some items that would fall within this type of care would be colorectal tumors, pediatric acute and lymphoblastic leukemia. Pulmonology deals with the diseases of the respiratory system. If your child is having any breathing issues, you certainly want to get these checked out as soon as possible. Some pulmonology issues could be life-threatening and some might not be. Issues such as childhood sleep apnea, cystic fibrosis, asthma, and pediatric bronchitis are all items that would fall within this care type. Rheumatology involves dealing with issues such as juvenile arthritis, pediatric rheumatic fever, and other diseases of the joints and muscles. This is where medicine attempts to act on things by preventing them from ever happening. Examples include things like well-child visits as well as immunizations. These exams and immunizations strive to identify problems before they happen and to prevent them. Shots or immunizations prevent major childhood illnesses. Well visits allow your child the chance to make sure they are developing and growing appropriately and are a good time to allow for education and guidance to be given to parents so that they know what to expect and what is appropriate. This is a daily part of family medicine and perhaps one of the most important parts. Pediatric medicine is a very vast subject, and within the previous mentioned categories, there are hundreds of specialty care types. We, as family doctors, can help coordinate your pediatric care and refer, if needed, to any of the specialties we have discussed. We understand how important your children are to you, and we also understand that you place more than trust in your physician's hands. You place your children in their hands. I hope that I've been able to help you better understand pediatric medicine and, more importantly, how to manage it and have your children live life at their best.